Hello, this is Dr. Clayton Simon at Marina Hills Animal Hospital. Our medical moment today comes to us from a local scout troop. They are working on their veterinary medicine merit badge, and they sent the following questions. The first is from Anya. What type of animals do you treat, and what type of veterinarian are you? Well, I'm here in Southern California in a neighborhood practice. I'm a general practitioner, and I care for neighborhood pets, which in this neighborhood primarily means dogs and cats. Technically, because of my study and licensing, I can work on any animal, but the reality is day to day it's dogs and cats. The occasional rabbit will sneak through the door, but we try to keep the snakes outside. Next question was from Sanvi. Which has a bigger attitude, the humans or the animals that you treat? That's a pretty good question. By and large, people who love pets are amazingly wonderful people, and I enjoy them very much. And the same is true of the pets that we see. It's an honor to be invited into the inner circle in someone's home and to be trusted to care for their beloved pet. It's also true that going to the doctor can be stressful, both for our patients as well as their owners. And so sometimes going to Marina Hills Animal Hospital equals a bad day, and we have to be prepared to deal with the bad day attitude that shows up both in people and their pets. But that's all part of it. A question from Maddie. How do you stay calm if an animal attacks you while treating? First off, we work really hard to anticipate the kinds of things that might trigger an animal to be aggressive. We work hard to anticipate the things that might trigger an animal to lash out, whether that's from fear or pain or aggression, and we work hard to diffuse that. So the first thing we do is we try to avoid it. We're big on praise, we're big on treats, we're big on safe restraint, that animals can't run around and do whatever they want to do. But as we get closer to the pet and get our hands on them, we have to be very cautious, and we always match the level of restraint to the task at hand. And if it's appropriate and useful, we will give medication to animals to help relax them to avoid conflict. Question from Victoria. Does it make you cry when you must put an animal down? That's an important question. It is a sad part of pet ownership that we live longer than our pets do. And so ultimately, when we get a pet, we know that at some point we're going to have to say goodbye to them. The thing that I focus on when I'm helping someone say goodbye to their pet is to remember the good times, because pets, dogs and cats, have been members of the family for years most of the time. And while it is sad when we have to say goodbye to them, there are times when it's absolutely the right thing to do. Out of kindness for the animal, is to euthanize them when their quality of life is poor and when there's nothing left that can be done. While it's a hard decision, it becomes the right decision. Next question is from Edhira. How many years did you go to school, and what courses did you take? Well, of course, I went to high school, and from there I attended UC Irvine. I double majored in biology and chemistry, and after 5 years, I graduated with a degree in biology. From there, I went to UC Davis, where I studied veterinary medicine, which is a 4-year program. So it took me 9 years to get through 8 years worth of college. What did I study? I took a lot of math and science. Veterinary medicine is a great career, but part of it is lots of school. If you enjoy school, you'll enjoy working on your degree. Question from Jacob. What's the worst case that you've ever seen? The case that came to mind when I read this was a family pet, a dog, that was run over by the owner in their driveway. It was a really sad situation. Everybody felt bad. They rushed the dog in here, and it was in pretty bad shape. But because of my amazing team and how quickly they moved, we were able to save this pet's life. It needed emergency surgery. It had a diaphragmatic hernia, it had broken ribs, it had broken pelvis, but we supported its airway, We got it into surgery, we repaired the things that needed to be repaired, and that dog lived a full lifespan after having been run over by a slow-moving car in the driveway as a young dog. So that was sad, unintentional, but it had a good outcome. So that was the good news on that. Question from Jackson: has a dog ever pooped in the middle of a shot? The short answer is yes, but it's rare because we anticipate the pets that are going to be very anxious and nervous, and we distract them from what's going on. Most of the time, a dog is very willing to accept a treat, and while they're eating Cheese Whiz off a popsicle stick, we can check their temperature and give them inoculation, and they don't even know what's happened. That's not always the case, but it's often true. For dogs that are very nervous in the animal hospital, we'll encourage the owners to administer medication at home to help relieve their anxiety before they ever walk through the door. Ultimately, if a pet is truly having a panic attack here in the office, we do have medications that we can give them to help them relax and be calm while we do the things that need to be done, whether that's give vaccines or draw blood and those sorts of things. The question is from Tanvi. How did you choose what type of veterinarian to be? When I first went to vet school, I thought that I would be a poultry veterinarian. Because of where I grew up and the things I experienced as a teenager, I knew a lot about raising birds, and I thought I would be a veterinarian for bird farmers. It turns out that veterinarians that work with bird farmers primarily are mathematicians. When you're dealing with a herd of 100,000 birds in one building, math and statistics plays a big role in how those animals are cared for. And while I'm a good doctor, I'm not a good math guy. So my first thought went out the window. The next thing I considered was being a large animal veterinarian. I liked the idea of driving in a truck with my arm out the window and wind in my hair. Yes, I had hair. But I spent a day on a cattle ranch where we were drawing blood, and the cowboys were running the cattle through the chute, and our job was to simply draw blood from their neck. And by lunchtime, I was so sore I could barely lift my arm to reach the handle of the truck to get my lunch. So I discovered that I'm not an athlete. And to be a large animal vet, you have to be an athlete. A lot of young people think about being an exotic animal vet, working for a zoo, working on giraffes or elephants. That's a cool job, but there's like 10 of those jobs in the state, and it's a very sought after position. So there's competition, to get into vet school. There's another round of competition to find a job working at a zoo. So I ended up being a small animal veterinarian kind of by default. I grew up with a pack of dogs and enjoy them and certainly know how to handle them and was comfortable around them, and found that the medicine and the surgery, caring for them, was pretty interesting. So that's how I decided to be a small animal veterinarian. Here's a question from Eric. What are the most common health issues that pets are brought in for? Here in South Orange County, where we're caring for household pets, the most common conditions that we see relate to skin disease. Dogs mostly, and some cats, develop allergies. It results in itchy skin. They break the skin, they get secondary infections, and so we see a lot of skin cases. Our clients do a great job of caring for their pets and keeping them close to home, so trauma is rare. We do occasionally see the leftovers from coyote attacks, but fortunately not very many hit by cars. I know in some communities, dogs running around the streets getting hit by cars is more common, not so much here where we are. Here's a question from Dylan. Are cats or dogs harder to treat? I think broadly speaking, cats are more difficult to handle because they really don't care for strangers and the things that we need to do with them. So I think that makes it a bit of a challenge. But a grumpy dog will send you to the hospital. So here's a question from Dylan. What's the craziest story that you've ever had? My favorite story comes from when I was in vet school. I was on the exotic animal rotation, and all of us students, we would show up in our white coats, and basically the residents were doing the work, but our job was to help and observe. And on our list for the day, it said 10 a.m. bat. And we were pretty excited about seeing a bat. So guaranteed that, at 9:45, we're down at the front desk ready to welcome the client and get her back to the exotic ward where we were going to examine a bat. And it was easy to know who it was we were looking for because the woman who showed up was wearing a black top with a big gold lame bat across the front of it and a pewter necklace that probably weighed 2 pounds, a bat hanging around her neck. We introduced ourselves and said, well, follow us, we'll go over here to the ward where they examine the exotic animals. What surprised me is that she wasn't carrying a box. I thought she'd have like a cat carrier or something, but she didn't have anything like that in her hands. The whole time that we're walking back to the examination area, this woman is telling us how amazing bats are and how they're misunderstood animals, and they're really quite wonderful. And her son, the electrical engineer, had created a device that could listen to the sonar that the bats were letting off so that when the Bat Rescue Society got a call, that they would know whether they should be looking in the attics or in the basements, because different bats in the community would like to roost at different locations and she could tell which one they're looking for based on their sonar with this device. Well, we were intrigued and interested, but after a while, we're checking our watches and it's like, well, we need to move on to actually talking about your bat. And honest to goodness, this woman takes her hand and she puts it in her shirt like this, and on her bra strap she had a little tiny bat that was as big as her hand that she had brought in for treatment. Turns out it had an ulcer on its chin. The resident prescribed an antibiotic, TMS antibiotic, and that was the end of that. So, but that was pretty wild. I still remember her to this day, the Bat Lady, as I recall her. Best of luck to you scouts in Troop 774. I hope that you all earn your merit badge. And if you have questions about veterinary medicine and you're in the local area, give us a call here at Marina Hills Animal Hospital. If you're not here locally, find your local vet. Veterinarians love to talk and tell stories. Our office phone number is 949-495-2224.